Sexual health is a crucial aspect of our well-being. Gonorrhea is a health issue affecting our sexual health that we need to talk about. So stick around to learn what it is, how to spot it, and why early detection matters. Gonorrhea is still a significant health issue. The germ that causes it is called Neisseria gonorrhea, and it's a type of bacteria which is known as gram-negative diplococci. After being exposed, it takes 3 to 7 days for symptoms to show up. The main area where the infection starts is in the lining of the urinary and reproductive system. This includes the inside of the cervix, urethra, skin gland, and Bartholin's gland. The infection can stay in the lower part of the genital area and lead to problems like urethritis, Bartholinitis, or cervicitis. It can also affect other areas like the throat, anus, and eyes. The type of cells in the vagina make it resistant to this infection in adults, but it can cause vulvovaginitis in children. If not treated, the infection can move up to the pelvic area, causing a serious condition called acute pelvic inflammatory disease. In rare cases, it can spread through the blood, causing problems like joint inflammation and arthritis. As the infection moves upward with the sperm, it can affect the upper reproductive organs. The bacteria attach to the sperm and travel up, causing inflammation in the uterus and fallopian tubes, known as endometritis and salpingitis. It's important to note that gonorrhea often occurs alongside other sexual transmitted diseases. Women with gonorrhea are also at risk of getting syphilis. In about 1/3 of these cases, there is also an associated infection called chlamydia. In adults with gonorrhea, around half of them don't show any symptoms. Even when symptoms are present, they are not specific to gonorrhea. The symptoms of acute gonococcal infection can be categorized into local and distant, which is metastatic features. Local symptoms include urinary issues. About 25% may experience pain during urination, which we call dysuria. Another one is vaginal discharge. Around 50% may have an excessive irritating vaginal discharge. Another symptom is pain and swelling. Women may have acute pain and swelling on one side of the genital area due to involvement of the Bartholin's gland. Another thing is rectal discomfort. Some may feel discomfort in the rectal area due to contamination from the genital infection. Other symptoms may include infections in the throat, and intermenstrual bleeding are also possible. So let us look at the signs. Signs are those which the doctor finds. Swelling and inflammation of the labia, which is the outer genital lips. Vaginal discharge is thick with pus. Another thing is the urethra and Bartholin's gland openings may appear congested. Squeezing the urethra or putting pressure on the Bartholin's gland may release pus, indicating possible abscess formation. So let us look at the distant or metastatic features. There may be signs of perihepatitis, which is inflammation around the liver, and septicemia, which is infection spreading through the bloodstream. Perihepatitis can result in adhesions between the liver capsules and abdominal wall. This is often associated with acute pelvic inflammatory disease. Septicemia is characterized by symptoms like low-grade fever, joint pain, inflammation of tendons, arthritis, liver inflammation, meningitis, endocarditis, which is heart infection, and skin rash. So let us look at the complications of gonorrhea. If not treated properly, acute pelvic inflammation can lead to chronic pelvic inflammatory disease. Uh, Other common complications include infertility, ectopic pregnancy. If you haven't seen the other videos, you can also see or when I talk about ectopic pregnancy. The ectopic pregnancy is due to the damage of the fallopian tubes. Another thing is painful intercourse, which is dyspareunia, and chronic pelvic pain. Other complications include tube ovarian mass and Bartholin's gland abscess, which are not so common. To diagnose gonorrhea, a test called nucleic acid amplification test is done using urine or endocervical discharge sample. It's best to use the first urine of the day or a sample taken at least 1 hour after the last urination. Nucleic acid amplification testing is a very accurate test with a sensitivity and specificity of about 95%. During the early stage of infection, samples from urethra, Bartholin's gland, and endocervix are collected for gram stain and culture. A presumptive diagnosis is made if gram-negative intracellular diplococci are detected during staining. Confirming the diagnosis involves growing the bacteria in a special culture media. Additionally, a test for drug sensitivity is performed to determine the most effective treatment. Let us look at preventive measures. Make sure the treatment for gonorrhea is thorough. Patients should be kept close until they are declared cured. Male partners for gonorrhea are also treated at the same time. Another preventive measure is you should stick to one sexual partner to avoid the risk of multiple infections. Use condoms until both partners are confirmed free from the disease. Remember that someone with gonorrhea might also have syphilis or chlamydia. So the treatment should address all three conditions. So thanks for hanging out and learning about gonorrhea with me. This information helped. Hit the like, share, and subscribe buttons. Spread the word for a healthier community. See you next time and stay healthy.